this is just a short video clip just to give you a demonstration on how to use a home blood pressure monitor, whether that be to explain to a customer how to use it or if you're taking a blood pressure reading in store. So there are many reasons why somebody would have a home blood pressure monitor, and one of the most typical reasons is if they are somebody who maybe suffers with white coat syndrome, where when they visit the GP or the pharmacy, their readings are often very high, and we want to get a better indication at home to see when they're in a nice relaxed environment, if we can build a pattern of blood pressure readings to get a better understanding of where their blood pressure is at. So generally what we would ask people to do is to take their blood pressure reading morning and evening for 3, if not 7 days before they go for their GP or their pharmacy visit, and to just document the date, the time, the arm that they took the reading on, and of course a record of the reading itself. So it's a very simple, non-invasive procedure. So to the blood pressure reading itself, the most important thing is that you're nice and relaxed before your blood pressure reading, that you haven't had a cigarette or a cup of coffee or just come in from intensive exercise within the last 20 minutes before you take your blood pressure reading. So if a customer came into store, what we'd ask is if they sat for 5 minutes just to get them nice and relaxed and settled before we take the reading. Then we're going to have a look and see if we can make sure that we can move their jumper or their clothing, that it's nice and loose, that it's not too tight, and we apply our cuff to the arm. Now the cuff size is very important because you need to have a good fitting cuff in order to get a valid reading. So the cuff size, just slide it right up the arm, up to where you have the bend in the elbow. And then you have your Velcro strap here, and you want your tubing to be towards the center. And you want to make sure that you can get 2 fingers between the skin and the arm. So it's not too tight, but also it's not too loose. You want to make sure that they are able to rest their arms. So the ideal place at home would be at the kitchen table, or when you're in store, that you just have a table surface there for them to rest their arm on. You need a nice high back chair so that they're feeling supported, that they can sit with their feet flat on the ground and they're nice and relaxed and rested. What we would ask is that during the reading that the customer doesn't speak, because if you speak and talk during the reading, it can interfere with the result. So you ask them to sit nice and relaxed. The arm is not bent, but rested on the table in front. You simply press the start button. Yeah, and as you can see there from the monitor, the numbers are rising as the cuff is inflating, and then it instantly deflates. So you have your top number over your bottom number, and this is always written like a fraction. So the top number is your systolic blood pressure, the pressure as the heart pumps. So we always expect that to be the higher number, and we like to see it less than 140. And our bottom number is your diastolic. It's the heart as it rests in between beats, and we always like to see that as a smaller number, and we want to see it less than 90. So what you would do is just write down the date, the time, the arm that the reading was taken from, and you write those numbers, the top number over the bottom number, like a fraction. The best thing to do and the best practice is to take 2 readings. So let them sit and wait, and 1 minute later then you can take a second reading. So it's a very simple, non-invasive procedure, but it is a very valuable tool because we get a lot of information from it, and it is great for people who are using them at home to be able to use them correctly and to keep a diary of those blood pressure results. Gives the GP a really wonderful source of information on their visit. Thank you.